Hi, I'm Mo Sharpe for the Power of the Patient Project. My guest today is Mandy Bonesteel. Mandy Bonesteel is a current undergraduate at Northern Michigan University, pursuing a Bachelor of Science in Sociology and a minor in Human Behavior. She works for AmeriCorps Vista in Marquette, Michigan as a resource developer and is co-leading a student organization that involves climate change solutions. She also spends time volunteering in the Marquette community at a COVID 19 vaccine clinic and as a participant in the COVID 19 vaccine trials. She is passionate about public health and health education and plans to pursue a PhD after graduating from NMU. Previously, she worked as a wildland firefighter for several seasons, completed Wilderness Emergency Medical Technician Program, and worked with the AmeriCorps programs revolving around conservation and land management. This past summer, she served as a senior research coordinator for MedFocus Research Project on the patient experience. So, welcome, Mandy. How are you today?
Good. How are you doing?
I'm doing good. I'm doing good. So we're going to go ahead and get started.
Okay.
First, tell us about your role of Senior Research Coordinator for MedFocus Research and what were some of your responsibilities in the role?
Absolutely. So some of my focus was on doing some of the literature review. So looking for pre-existing research on the topic of patient healthcare experiences in healthcare settings. And then a lot of my focus was on creating those patient surveys, coming up with questions for the patients, distributing the surveys, and then data analysis after the surveys were complete and filled out towards the end of the project.
Awesome, awesome. That seems like it's a lot involved in that and just getting your hands into it. So
Yeah.
tell us about the summer research project and the process your team used to reach out to patients.
Sure. So the project was intended to find out the social determinants of patient healthcare experiences in healthcare settings. So we were looking really for those social determinants of bias, such as that could be gender, social class, race, educational level, things like that nature. And then other things such as differences in different healthcare areas. So we really focused on mental health care, women's health, and primary care offices.
Okay, that is you have your hands full.
Yes, you have no idea.
What is the most important feedback you got from the patients, and what did it tell you and your team?
Okay, so two things really. One was a big one that was reported was wait times to get in to see providers. In some instances, that could be up to more than 4 weeks. So if somebody's looking to get an appointment with their healthcare provider, some patients are having to wait over a month to even get an appointment. And that can be really important, especially if they have some sort of major health issue going on that's been undiagnosed and then they have to wait. And then the other thing was there was really stark differences in healthcare experiences between men and women. Women reported being discriminated against or feeling like they were treated differently based on their age and their gender, and other different social determinants like social class and education were some huge factors. I believe over 70% of women said that they had felt that they were treated differently or that their concerns were not taken seriously by admitting staff or their providers, compared to over 90% of men that said that they didn't have that issue.
Wow, that's a big difference. But I can see where it's seen as that, as we understand in society.
Yes.
Finally, based on what was learned from the study, what are some things that you feel providers can do differently to create a better experience for the patients when they visit a healthcare office?
Absolutely. So one is just finding a way to reduce those appointment wait times would be huge for a lot of folks. Being able to get in when they need to get in, and then really taking their patients seriously, taking the patient's culture into consideration, treating every patient with respect, and really putting that ego aside and actively listening to patients. We can see lots of times where a patient might be dismissed. they might be having, we can look at, say, the difference. I'm just going to use an example here of women and heart attacks. Women have very different symptoms when they're having a heart attack than men, and it often goes like misdiagnosed as anxiety or panic attack, because those differences are very, profound. So just really listening to what the patient's telling them, and not just being dismissive of those symptoms, and just treating everybody again with respect and taking each person's, differences into consideration.
Yeah, that can go a long way, and just improving that aspect of it and make people
Yes.
happier. So you don't have a lot of irate.
Yeah.
But that's all for today. So
Okay.
thank you so much, Mandy, for
Yeah.
taking the time out today to speak with us.
Yeah, absolutely. Thank you so much for having me. It was really great to work with Power of the Patient this past summer. Definitely got some great experiences out of it and learned a lot, and I would absolutely do it again.
All right. And I'm Mo Sharpe for the Power of the Patient Project. We'll see you next time.
All right. Have a great day.